Why should the average taxpayer pay for somebody who they believe is having a quote-unquote delusion? This isn't delusion. This is my everyday life, so it's kind of ridiculous.
Tonight, transgender Kentuckians are telling us their health care will soon be disrupted after State House Republicans in Frankfort pushed a controversial bill past the finish line. The vote coming an hour before the midnight deadline just last Friday night. The bill in the Kentucky House is now on a pathway to become law. It's our top story here at 5:30. Hello, everybody. I'm Doug Proffitt.
And I'm Connie Leonard. House Bill 495 protects the widely discredited conversion therapy in Kentucky and prevents Medicaid from covering gender transition treatment. Isaiah Kim Martinez is following the fallout.
For months, Karma Bell Marshall's hormone treatment has been covered by Medicaid, but soon that could all be changing, and she could be coming out of pocket a couple $100s a month.
I'm in a one-income family household, so money is tight for us.
With 67 members voting yay, 19 members voting nay.
We're just trying to exclude one group of people because it's an easy wedge for the Republicans to gin up outrage so they can get people on their side. And it's really sad and a dark time here in Kentucky.
One of the more contentious Kentucky bills this year, largely dividing lawmakers along party lines, passed the State House with less than an hour to spare. House Bill 495, which would protect conversion therapy and ban the use of Kentucky's Medicaid program to cover gender transition treatment, is on a path to become law.
What we don't talk about is the dangers of what happens to a child who's told something that is not true over their life over and over and over again.
Advocacy groups say transgender Kentuckians represent less than 1% of the state's population, but it was clear they were a focus of this legislative session.
We have Kentuckians who are actively contemplating suicidality, who are contemplating leaving a state that they have called home their whole life. I've even thought about, is Kentucky a safe place for me to continue living and existing?
Marshall believes state lawmakers are feeling the pressure from executive orders from the White House.
It's a trickle-down effect. They're taking their orders from the top. We see it across the United States, states all following in line.
Here's State Senator Lindsey Titchener on the Senate floor last week.
And we need to start allowing children to grow and develop and process those things on their own and not be forced to affirm them in a position that is contrary to reality.
Governor Andy Beshear has promised to veto this bill, but the Republican-controlled legislature has the power to override his veto. Isaiah Kim Martinez, WHAS 11, on your side.
And if you or someone you know is needing help, remember that the Suicide Prevention Hotline is available 24/7. Just call 988.